Hello and welcome to CARES, Cancer Rehab Ed and Support. Today's update is about opioid conversion in adult patients with cancer, based on the 2025 Joint Clinical Practice Guideline developed by ASCO and several international palliative care organizations. Let's begin. About 60 to 70% of patients with advanced cancer experience significant pain. Opioids are commonly used, but approximately 20 to 40% of patients either develop intolerable side effects, lose effectiveness, or both. In these situations, opioid rotation becomes necessary. The new guideline outlines 3 essential steps: pre-conversion assessment, conversion strategy, and post-conversion monitoring. First, pre-conversion assessment. Pain that appears uncontrolled may not always be due to opioid failure. Sometimes, patients are missing doses due to fear of addiction or stigma. So, before changing medications, clinicians should assess the patient's pain in functional terms, evaluate their liver and kidney function, check for drug interactions, and clarify the patient's goals of care. It's also important to involve caregivers, who will play a key role in monitoring the patient after the change. Second, the conversion strategy. The guideline recommends using published consensus tables when switching opioids, especially for medications like methadone that require advanced knowledge. Importantly, the guideline advises against automatically reducing the opioid dose by 25 to 50%, which was a common past practice. The panel determined that the established conversion ratios already fall within a safe dosing range and should be tailored based on individual response, not reduced as a default. Also, breakthrough pain requires separate attention. The appropriate dose for breakthrough episodes may not correlate directly with the around-the-clock dose. Third, post-conversion monitoring. After switching opioids, close follow-up is critical. Patients should be assessed not just for pain relief, but also for functional improvement, whether they are able to do the activities that matter to them. Clinicians should watch for signs of withdrawal, subtle neurotoxic symptoms, or other side effects like fatigue, dysphoria, confusion, or pruritus. If any of these arise, the opioid dose may need to be adjusted. To quote Dr. Mellor Davis, co-chair of the expert panel, "You'll never regret making an extra follow-up call, but you might regret not checking in soon enough." In summary, assess carefully before converting, use evidence-based ratios during conversion, and monitor closely afterward. Thank you for listening. Please subscribe to CARES for more clinical updates designed for primary care providers involved in cancer care.